Good afternoon. Thank you for joining us as usual. I'll start with the update on the latest COVID statistics. Since yesterday, an additional 5 cases have been confirmed, which takes the total now to 18,373. A total of 611 patients are currently in hospital with suspected or confirmed COVID, which is an overall decrease of 5 since yesterday, but an increase of 2 in the number of confirmed cases. As of last night, 6 people were in intensive care with either confirmed or suspected COVID, which is a decrease of 6 on the number I reported yesterday, and there are still only 2 confirmed cases in ICU in the whole of the country. Since 5th March, a total of 4,132 patients who tested positive and been admitted to hospital have now been able to leave hospital, and I am very pleased to say that in the past 24 hours, no deaths have been registered of a person who had been confirmed through a test as having the virus. And that, of course, means that this is the 7th day in a row in which no deaths have been recorded in our daily figures, and means that the total number of deaths in Scotland under that measurement remains at 2,490. Of course, National Records of Scotland has just published its regular weekly report, and that is more comprehensive than our daily figures. Like the daily figures, it includes deaths of people who have been confirmed through a test as having COVID, but it also covers cases where the virus had been entered on a death certificate as a suspected or contributory cause of death, even if the presence of the virus hadn't been confirmed through a test. The latest NRS report covers the period to Sunday 12th July, Sunday just past, and to remind you, at that point, according to our daily figures, 2,490 deaths of people who had tested positive had been registered. However, today's report shows that by Sunday, the total number of registered deaths with either a confirmed or a presumed link to the virus was 4,187. Of those, 13 were registered in the 7 days up to Sunday, and that is a decrease of 5 on the week before. The number of COVID deaths in care homes increased slightly from 5 to 7, meaning that deaths in care homes made up just over half of all COVID deaths last week. And finally, the total number of deaths recorded last week in Scotland from all causes, not just COVID, was 56 below the 5-year average for the same time of year. And this is the 3rd week in a row now that the total number of deaths has been below that 5-year average. And last week was the 11th week in a row in which the number of deaths from COVID has fallen. So these weekly figures, although they capture more cases, still show the same trend as our daily figures. They show that COVID is now being driven to very low levels in Scotland. However, we mustn't forget that these numbers also speak of tragedy for many people. Every death which has been recorded has resulted in loss for a family or friends, and I want to send my condolences again today to everyone who is grieving the loss of a loved one. And I want, as always, to thank our health and care workers. And since today is Scottish Care's Care Home Day, I want to thank in particular Scotland's care workers and also all of the other staff who are absolutely essential to the operation of care homes, such as cleaning staff, kitchen workers and many others. All of you in recent months have shown skill, dedication and compassion above and beyond the call of duty, and you have my heartfelt thanks for that, and I'm sure you have the heartfelt thanks of everybody across our country. Now, in a few minutes, the Economy Secretary will talk a bit more about some Scottish Government support for business, and I want to cover 2 points today which are closely related to that. The first is to let you know that the Scottish Government is publishing a new paper today which sets out our approach to surveillance of the virus as we move forward and the management of outbreaks. As I've just said, prevalence of the virus in Scotland has now fallen to very low levels, but as we all go out and about more, it becomes increasingly important that we are very alert, hyper vigilant to any early warnings that case numbers might be starting to increase again. It's also important that where cases do arise, we are able to respond quickly, as happened last week, or rather 2 weeks ago, in Dumfries and Galloway. Our Test and Protect system is absolutely vital to that, because that means we pick up on individual cases or clusters of cases and are able then to work to disrupt the chains of transmission. But as today's publication sets out, we're also using other sources of information to give us as early a warning of any potential problem as possible. So, for example, NHS 24 call data, which shows the number of people phoning up NHS 24 asking about COVID-like symptoms, is potentially a very early indicator of community transmission in some areas. And whole genome sequencing, on the other hand, allows us to assess the likelihood of different cases being part of the same cluster. We've also established a data and intelligence network, which has representation from academia and key public health officials, which is able to assess relevant information quickly and then allow that information to inform our decision making quickly, both at a national and at a local level. Health Protection Scotland has also updated its guidance on the management of public health incidents, which helps to ensure that we can respond rapidly to incidents or outbreaks, again, either at a national level or a local level. These are all really important ways of preparing ourselves to identify and deal with outbreaks of COVID as they arise. And all of that is important. But as I indicated a moment ago, test and protect is perhaps the most important of all and is central to the entire system. So let me repeat again the advice you have heard me give on many previous occasions. If you have symptoms of COVID, a high temperature or fever, a new cough or a loss of or change in your sense of smell or taste, please act immediately. Don't wait, as some of us have tended to do in the past, to see if you feel better before doing anything. Act immediately. And what you should do is firstly self-isolate and secondly book a test through the NHS Inform website, or if you prefer by phoning 0800 028 2816. Speed of action here is of the essence, and if you follow this advice you are helping to ensure that where cases of COVID do arise, our contact tracers are able to step in quickly and break those chains of transmission. That advice and our wider surveillance system becomes even more important, and I can't stress that enough, as we open up more public services and different parts of our economy. And so it's especially important to talk about this today, because today marks the biggest step for Scotland out of lockdown so far. The child care sector can fully open from today. The Education Secretary will join me here tomorrow and will be able to say more about that. Venues like museums, galleries and other attractions can also welcome visitors from today, although in many cases you will need to book tickets in advance. Hairdressing services resume today. In fact, I understand some opened at midnight to meet demand. I wish I had known about that. Cinemas can also open their doors from today, and places of worship can reopen for communal services and prayer for up to 50 people, if that can be accommodated within physical distancing. Our tourism sector also can fully reopen, so hotels and bed and breakfast, for example, can welcome guests, and indoor hospitality such as pubs and restaurants can open again. All of this, of course, has strict conditions attached to it. But it is all good news. These changes are long awaited and they have been very hard earned by everybody across the country. But I have to say that I am even more nervous about today's changes than I have been about earlier changes in previous phases of coming out of lockdown. And that's because, as I covered yesterday, today's steps are by some margin, and I mean that by some margin, the highest risk changes we have made since we begun the process out of lockdown. Many of these changes, as you've just heard, involve indoor activity, and we know that the risk of the virus spreading indoors, in a pub for example, is significantly higher than it is outdoors. That's why we've deliberately waited until infection levels were very low before allowing these services to restart. That gives us the best possible chance of managing the risks that reopening indoor services creates, but it doesn't remove those risks. And so it is vital, more vital than it has been at any stage of this crisis so far, that all of us stick rigidly to the rules and guidance and how to behave in these different settings. Because it's only by doing that as we open up these services, we will stop the virus spreading again. So give your contact details when you're asked for them. That means that you can be contacted if you go to somewhere which is linked to new COVID cases, and the ability to contact you will be essential to breaking the chains of transmission that I spoke about earlier. Keep a 2-metre distance, and where you are in a 1-metre zone, comply with all of the necessary mitigations. Wear a face covering in indoor environments, and remember they are mandatory in shops and on public transport. And continue to wash your hands regularly and thoroughly. All of these steps, as I've said before and will continue to say, are more important now than they've ever been. And for people running these premises and workplaces and attractions, please follow all of the relevant public health guidance. It has been put in place to keep you, your staff, your customers and your visitors safe. And it's also there to minimise the risk of us having to close any of you down again in future if the virus starts to spread. I mentioned yesterday that the state of California in the USA has just shut all of its bars, cinemas, restaurants and museums all over again. That must be a reminder that our progress out of lockdown could yet go into reverse. And it will go into reverse if we see signs that the virus is starting to spread widely in the community again. So all of us must do everything we can to ensure that that doesn't happen. So in the days and weeks ahead, enjoy your first meal out in a long time if you're able to do that. Enjoy your first drink indoors if you want to do that. Enjoy your first haircut, which I know many of us across the country will certainly do. And please support local businesses as you do that wherever you can. They need our support at this time more than ever. But do all of that really carefully. Cooperate with staff and organisers at these different venues. And if any venue to you doesn't seem to be taking all of this advice seriously, if it doesn't ask for your contact details and it doesn't seem to be clear about physical distancing, then take your custom elsewhere because that is for your safety and the safety of those around you. Ultimately, it's only by sticking to all of these rules that any of us will be able to continue to enjoy these services for the rest of the summer, through the autumn, into winter and beyond. I want to leave you, before handing over to the Cabinet Secretary, with just one other piece of information that I thought it was important to share with you today, because it shows, again, the progress we are making, but it will also hopefully help motivate all of us to keep doing the right thing. The figures I report each day, as you know, include the total number of people in hospital with suspected or confirmed COVID. But figures published today by Public Health Scotland give a breakdown of how many people were actually admitted to hospital on each day last week, between the 3rd and the 9th of July. And they show that on 3 days in that week, 3 separate days, there were no admissions to hospital of confirmed COVID cases. In fact, since the 26th of June, we have had 6 days in total where there have been no confirmed cases of the virus admitted to hospital. If I think back to the early part of April, in fact, into May, what I would have given to stand here and give you figures like that. And yet that is the progress that I'm now able to report to you. And just like the days where we are able to report that no deaths have been registered under our daily measure, and now we've had 7 days in a row of that, these hospital numbers are a really significant milestone. I don't want to go backwards, and I know you don't want to go backwards to the days where each and every day people were being admitted to hospital. At the peak of this outbreak, 200 people, more than 200 people, were being, for a period, admitted to hospital every day. Let's not take the risk of going back to that. Let's make sure we do everything we all need to do as individual citizens to protect ourselves and protect each other and keep us on the right track when it comes to tackling and hopefully eliminating this virus. So let me leave you with the most important advice of all, facts. If you remember nothing else, I'm asking you to remember facts. Face coverings in enclosed spaces, avoid crowded places, clean your hands and hard surfaces, 2 metres distancing remains the overall rule, and self-isolate and book a test if you have symptoms. If we all follow these 5 basic measures, then the nerves and anxiety that I, and undoubtedly Jason will also articulate this later, are feeling right now will hopefully prove to be not well-founded, because we will manage to open up our country again without allowing this horrible virus to spread. So let's, as we have done over these 4 long, painful months, keep working in that spirit of collective solidarity and keep beating this virus. Thank you all so much. And I'll now hand over to the Cabinet Secretary for the Economy before Jason Leitch says a few words, and then we'll go on to questions.
Thank you, First Minister. Today marks a significant step forward for our economy, with the majority of Scotland's tourism and hospitality sectors beginning to reopen. Guests can now stay in hotels and plan to visit attractions such as museums, galleries and historic sites. Cafes, restaurants and bars can also begin to serve customers indoors, and people can once again look forward to watching a film in the cinema or visiting their local library as they too prepare to reopen. This is all underpinned by strong guidance which has been closely developed by each sector with the safety of employees and the public in mind. We all have a duty to enjoy these new freedoms responsibly, so I would ask people to plan visits in advance, respect the local community you're visiting and adhere to the facts at all times. There's also good news for the construction industry today, which will be moving to phase 4 of its restart plan. This means that close working can now take place on site, if necessary, and with appropriate PPE. And we have undertaken significant work with the sector to ensure that this will not compromise PPE supplies required for the NHS. Going forward, we will continue to work in partnership with these key sectors. The Scottish Council for Development and Industry and the relevant bodies will be helping raise awareness of the test and protect system with our business community. This will ensure that smaller firms in particular have information they need about test and protect and its role in keeping the virus under control. And that vigilance will help economic recovery and help businesses. I'm pleased to say that Scotland's housing market is receiving a boost today with reductions in land and buildings transaction tax coming into force. The threshold at which the tax is to be paid has risen from £145,000 to £250,000, excluding the additional dwelling supplement. This will result in savings for home buyers of up to £2,100 and will stimulate the construction sector and the wider economy. So we've taken a distinctly Scottish approach to LBTT, reflecting our overall economic response to the pandemic, as well as making more than £2.3 billion available in business support. We're also implementing a £230 million economic stimulus package to create jobs in construction, low carbon schemes and digitisation. As part of this, I announced last Friday a £38 million fund for high growth companies. Last week, we also committed a further £100 million to employment support and training. And I look forward to outlining our priorities for this funding tomorrow to Parliament, including how we will invest in the future of our young people, given the scarring effects of unemployment on them are well known. We are determined that they will not be unfairly disadvantaged by the economic impacts of this situation. And in relation to this, we're also calling for urgent discussions with the UK Government on their Kickstart employment programme. While we welcome the additional investment, we are disappointed about the lack of consultation on the issue, and we've been working with industry on our own youth employment response, including asking Sandy Begbie to develop an implementation plan for a job guarantee in Scotland. And we need the UK Government to work in partnership with us to ensure that their scheme, which covers the whole of the UK, delivers for the young people in Scotland. We're also doing all we can to support our summer school leavers, and the Developing the Young Workforce programme is running a series of events for them over the coming weeks. Registration closes on Friday, and those wishing to take part should visit www.dyw.scot for more information. And while we're seeing people return to work as the economy reopens, figures published today show that 29.8% of Scottish workers have been furloughed. So we would ask again that the Chancellor considers extending the job retention scheme, particularly for sectors especially hard hit by the pandemic or those unlikely to recover quickly. It is only fair that these businesses are supported when they have had to close through no fault of their own and have undoubtedly helped save lives as a result. So we will continue to press this cause also. Thank you.
Thanks, Fiona. And Jason.
First Minister, let me be clear before I start that, as the First Minister suggested, I am nervous today. Today feels like a big day in the route map out of lockdown. But let me speak briefly about the guidance around reopening places of worship, which happens today. It's been an incredibly difficult time for faith communities who have been unable to come together in person during the past weeks and months of the pandemic. So it's a great relief to many that from today, places of worship can be opened for congregational services, marriage ceremonies and religious life event ceremonies, depending on your place of worship. Places of worship play a vital role in the life of many people and, of course, in bringing communities and generations together across Scotland. However, the communal nature of places of worship also makes them particularly vulnerable to the spread of COVID-19, and you can see that from experience around the world. So there are a number of guidelines and regulations that have been put in place to keep people as safe as possible. No more than 50 people should gather in a place of worship at one time. This is to help to manage the risk associated with these larger indoor gatherings. We need to proceed with caution. I know that places of worship have been working hard to place safeguards in place to manage the risk associated with congregational services, and we're grateful to them. The number of people who can gather are lower in some cases. Up to 20 people can attend a marriage ceremony or a civil partnership registration, and up to 20 people can attend a funeral service. These lower limits also apply in other venues where events like these can take place. At this stage of the route map, we're stipulating there should be no singing or chanting inside places of worship, even if social distancing can be observed or face coverings are being used. All individuals must keep at least 2 metres distance between others while they are in a place of worship or in the grounds. This does need to be maintained between households, but not if you're in an extended household or a carer and the person assisted by the carer, just as you were outside. We're asking those responsible for places of worship to keep a temporary register of those who attend, staff and volunteer contact details for a period of 21 days. This is to support contact tracing around our test and protect system, to allow us to get in touch if anybody in that setting tests positive. When entering or leaving, you should, of course, wash your hands, ideally with soap and water, and if not, with hand sanitizer. Anyone who has symptoms of COVID, and you now know these symptoms, I'm sure, of by heart, should go nowhere near a place of worship. They should stay home, self-isolate, and get a test. Thank you.
Thanks, Jason. We'll move straight on to questions now. Lindsay Bewes from BBC is first today.
Good afternoon. Thank you, First Minister. We are hearing from hoteliers in Skye that they're coming under pressure to pass on the VAT cut that's been introduced today. Do you think hospitality firms should pass that cut on to customers, or should their customers accept they won't benefit, let firms pocket the difference because they need the financial boost? And just if I may, the NHS is starting to clear a backlog of treatments now. Given the scale of the challenge facing the health service, do patients need to accept longer waiting times for the foreseeable future?
Thanks, Lindsay. On the first question, I'm not going to dictate individual business decisions to hotels or any other businesses, but the VAT reduction for tourism, hospitality, the Chancellor announced last week, which we welcome, is designed very much to support businesses through a very difficult period where their trading conditions continue to be limited. And I think it's really important to be clear that that is the purpose of it. And as customers or consumers, where we can, we should try to find ways ourselves of helping local businesses in particular, shopping local if you can, where you might not have done that previously, and going on holiday in Scotland if you are able to do that. I know not everybody can do that. So that would be my general answer to that. I'm going to hand over to Fiona on that point. I'll later then hand over to Jason on health services, but I would just say we are trying to get the health service running as close to normal as we can, as quickly as possible. But as you will have heard Jason and I think Gregor and Jean Freeman say here in the past, we are asking patients to be patient, if you like, because just like it will be the case in parts of the economy, the different ways of working will require different behaviours. And in some cases that may mean waiting a bit longer, but we are working really hard, and the health service is working really hard to get the system operating as quickly and as efficiently and as close to normal as possible. Fiona, do you want to take the first point and then Jason?
Yeah, just briefly, the cut in VAT on tourism is really welcome. It was the second highest in Europe at 20%. It's now down at 5%, and that will be a big economic stimulus. And obviously, as the First Minister said, individual businesses can make their own decision. But it's really important in the most beautiful places that we have in Scotland that we have a sustainable tourism industry, and that means they need to be here not just in the next month but in the next 6 months. And so therefore they will have to work out in their own business plans how much they can do in terms of their occupancy, what their costs are, what their staff are, the staff costs are. And obviously a lot of hotels want to make sure and retain their staff and support them because they're vital, again, as part of that economic activity within a local community. So in terms of encouraging more people with reduced costs and reduced prices because of the VAT cuts, some may choose to do that. But it's in everybody's interest, tourists, customers and hotels, to ensure that we have a strong tourist and hospitality sector, not just today, tomorrow, but in the years to come. And one of the ways of doing that is making sure we all support them and recognise that they will need to address some of the pricing issues themselves, but in a way that can keep them in business. This has to be about keeping them in business.
Thank you, First Minister. We have three simultaneous challenges: dealing with the actual pandemic and the infections, keeping the health service ready for a potential second wave or a cluster of cases, and, as you described, the remobilisation of the existing health service. The Cabinet Secretary for Health chaired the remobilisation group this week with stakeholders. We had two presentations, one on the state of the pandemic and one, you wouldn't be surprised to hear, on the performance and getting out of that backlog. So I'm very confident that the health service is focused on that. We will get out as fast as we can. We will start to see outpatients, but it will, as the First Minister suggests, have two things inside there: new ways of working, so perhaps more video conference appointments, perhaps more phone calls before your scheduled hospital appointment, and you may have to move. So you may go to the Golden Jubilee for your cancer care rather than your conventional hospital for your cancer care. And we do need you to be patient, because some will have to wait just a little bit longer.
Thanks, Jason. Ross Govins from STV.
Afternoon, First Minister. Politicians and journalists, we've talked a lot about the so-called new normal. After today's relaxation, are we finally now in that new normal? And do you think people are ready to live like this for some considerable time to come?
It's a good question, Ross. I'm always slightly hesitant to answer a question like that in a way that suggests we've reached some kind of definitive, unchanging point in this journey through a pandemic, because the circumstances and the outlook remain very uncertain, and we're in a much stronger position today than we have been at any point so far. But as I say, that can change very quickly. So I think we all have to, firstly, do everything we can to minimise those risks of things going in the wrong direction again. But secondly, be prepared for the need to adapt to changes as we go through this next period. But as I said last week with face coverings, I would say again with physical distancing and with these other measures that we're advising people to take, these are going to be pieces of advice that we are appealing to people to follow for the foreseeable future. I spoke a bit yesterday about the work we are doing to prepare as far as we can for the potential second wave, as people call it, when we get into the autumn and winter months. But right now, our immediate challenge is a resurgence of the first wave. So this virus hasn't disappeared. It has not gone away. It is still there. And the minute we lower our guard or, turn our back and think we can stop taking all of these precautions, it will spread again quicker than any of us would like to contemplate. And as I say, that's not conjecture. That is happening already in many parts of the country. So yes, I'm not saying that what we are doing now is going to be unchanged for a set period of time, but we're not going to be stopping advising people to do what's encapsulated in the Facts campaign for the foreseeable future. And I think, as I said, with face coverings, people have to get comfortable, or as comfortable as possible, and used to living with these restrictions and with this advice, and get in the way of following it, because it's really important that we all do. Do you want to add anything, Jason?
Only what I've said before is that this virus takes about 3 weeks to really tell us what it's going to do. The incubation period is about 5 to 7 days. The mild illness is about a week after that. The serious illness happens in the week following that. So we haven't opened everything. You only need to look at my inbox for a list of the things we haven't opened. But we have to be careful, we have to be gradual, and that's so hard for business owners and people who make their livelihood from the businesses that haven't yet been in the route map to open. So I'm very conscious of the advice we give to the First Minister about when and what can open and the decisions the Cabinet are taking on that. But we have to treat this virus very seriously. As I came down, 50 new cases in New South Wales that they think have come from Melbourne from travellers. It takes 48 hours and it can be out of control.
That's why, over the height of this pandemic, a lot of the focus and the figures I give every day have understandably, for emotional reasons apart from anything else, been on deaths, and that will always be important. But over this next period, it's the number of cases every day that we are paying closest attention to. Because, as Jason says, it's the number of cases today that if we start to see the sign of those increasing, potentially could be the hospital admissions, the ICU admissions, and unfortunately the deaths 3 or 4 weeks from now. So that's what we pay close attention to. And I say I'm nervous about what's happening in Scotland right now. I think that would be the case, whatever was happening across the world. But that nervousness is underlined by what Jason's just recounted there from Australia, what we see in California, and what we see in many. I was reading reports this morning, and it was a report in the media, so forgive me if this has not been, I'm not about to quote this entirely accurately, but Israel right now has gone from something like 10 cases a day to 1,500 cases a day. So this so quickly can go out of control. And as I said yesterday, I'm not trying to say all of this to be the voice of doom or to depress people, but we must be so vigilant if we don't want to see all this progress sent into reverse. And if the price of that is wearing a face covering and washing our hands and keeping distant, I think that's a price worth paying to not go back to the kind of situation we were in just a couple of months ago. Alan Smith from Bauer.
Thank you, First Minister. The National Records of Scotland figures show that people in the most deprived areas were 2.1 times more likely to die from COVID-19 than those in the least deprived areas. So looking to perhaps see what your understanding of why that may be the case. And a question for the National Clinical Director, if I may. Beauticians are telling us that they're obviously looking forward to reopening next week, but they're still in the dark as to what they'll be able to offer customers, as they haven't seen specific advice for Scotland. Many are basing it what they're offering on the guidance in place in England, where people can't be offered facial treatment. So will that be similar rules for Scotland too?
I'm going to hand over to Jason on both of these points, actually, because the information in the NRS report is very important to us in understanding how this virus is impacting on different parts of the community. And that understanding is still developing, but both in terms of knowing that, but also tailoring any future response and understanding, because one of the things we know about this virus is that it is, or are learning about this virus, is that it's leaving people with longer term health problems. So we need to have that understanding. And on beauty parlours, I totally understand, but we need to be very cautious and take very considered decisions about just what is and isn't permitted, because we know that close contact, face-to-face contact, is the riskiest of all. So we're being very careful about reaching some of these decisions.
It won't be any surprise to anybody who follows Scotland's public health and cares about Scotland's public health that diseases expose health inequalities. That's how, unfortunately, chronic disease in particular works. COVID-19 is no different from many, many other diseases. It does, and I'm not surprised by the NRS's findings today. We've seen it around the world in reports. We've seen it in UK-wide reports, that COVID-19 affects you worse if you are poorer. There is no way around that. And Scotland has deep-seated health inequalities. So it's about poverty, it's about housing, it's about access to care, it's about multi-occupancy households. It's all kinds of elements that are deep-seated and ingrained. And Public Health Scotland being invented during this pandemic was one of the responses to deal with those health inequalities, and then a pandemic arose. So the focus on public health is really, really important, and I hope will leave us in good stead to now and in the future deal with some of those deep-seated health inequalities. But it's really, really difficult for these communities. I completely accept that. The beauty therapy, massage therapy, complementary therapies, my inbox is full of exactly what those are and when they can open. We have about a week, so the 22nd is the indicative date for beauty therapy. The Deputy Chief Nursing Officer met with the advisory group yesterday and they are setting out what that guidance will be in the next few days. I would anticipate it will be very similar to the English guidance. So that would be my trail, but I haven't actually seen what the final version of that is going to be.
Thank you. Becky Clark from Global.
Thank you, First Minister. Labour market statistics are due out tomorrow, and it's the first quarterly set of data for the 3 months in lockdown. Everything we're seeing on the high street indicates a really alarming set of figures, and this might just be the tip of the iceberg. I appreciate that the Cabinet Secretary will make a statement tomorrow on employment support, but how fearful are you for the weeks and months ahead? And what would you say to people who are going to be losing their jobs in that time?
I'll hand over to Fiona in a second, who will make a statement in Parliament tomorrow. We won't see the labour market statistics until tomorrow morning, so we have no advance knowledge of them. But I would expect to see a possibly quite significant rise in unemployment. I think anybody who just takes a step back and considers what the economy has been through in the last 3 months will understand why that is the case. But that is why we are so determined in the short term to do everything we can to protect jobs and also to support those who perhaps do lose their job into training or alternative employment as quickly as possible. And that will be part of the ground that Fiona covers in her statement tomorrow. But I will hand over to her to perhaps say a word or two more about that.
Yes, this is one of the biggest challenges that we face, and we know that the job retention scheme has helped protect businesses and also their staff. In terms of how we want to support people, there's basically 3 stages. There's job retention, and we think that it's actually going to be cheaper for the UK government to support people maintain their position within jobs, within companies, rather than become unemployed. The second one is job support, and I'll be setting some of those issues out tomorrow. Yes, we want to emphasise our support in developing the job guarantee and our help for young people, but there'll be people that will be losing their jobs who need to retrain quickly, so we need to think about how we support people in terms of moving to other areas where we know that there will be growth in jobs. And then thirdly, it is that growth in jobs, it's job creation and working with businesses and making sure that we have enough of an economic stimulus, both from the powers that we have, but also encouraging the UK government, particularly on a new capital economic stimulus to help that area. So my message to people is that we understand the seriousness of this, we stand with you and we want to support you. We'll work with businesses, and I spent this morning talking to business organisations and also other economy ministers within the Scottish Government about how we can do all of those 3 things: job retention, job support and job creation.
I think it's an exaggeration to say that the priorities and the focus of this government for the foreseeable future can be summed up in 2 words, and they are interrelated: health and jobs. That is going to be our absolute preoccupation for as far into the future as I can see. We've got to keep the population healthy and continue to drive this virus down as far as we can. And we've got to, as Fiona says, protect jobs, retain jobs, support people, and then support our economy to grow in the way we want it to in the future. So health, jobs, that's what we'll be absolutely focused on for as far as we can see. Callum McQuaid from Central FM.
Thank you, First Minister. Over the weekend, there were lots of pictures on social media of people at beer gardens, and it was quite clear to see that they weren't all following the 2-metre social distancing rule. Are you concerned that this is going to get worse now that pubs, restaurants and hotels are reopening today? And what would you say to those businesses in the hospitality sector who perhaps can't open yet because it's not possible for everyone to keep apart from each other?
Well, we obviously have allowed an exemption for hospitality from the 2-metre physical distancing. As long as a business puts in place the required mitigations, they can operate at 1 metre. That will still be difficult for some businesses. I understand that, but that rule, I'm afraid, is there for a reason, and it is about protecting people's health. And you ask it, am I concerned about these things, about people not following the rules, either deliberately or probably more likely inadvertently, because you end up having a laugh and a couple of drinks with pals in a beer garden or inside a pub, and suddenly you realise you're not staying at the required distance apart. Yes, I am concerned about that. That's why I'm taking so much time every day to try to reiterate and impress upon people the importance of sticking to these rules. And I send that message to anybody who's going to be using a pub as a customer, but also to people who own these businesses. If these rules are not respected and the virus spreads again, then I am afraid I'm going to be standing here in a few weeks' time and saying, like the Governor of California had to do the other night, we're shutting pubs and restaurants again. I don't want to have to do that. I really, really don't want to have to do that. But let me be clear that I will not hesitate to do that if I am advised that that is required to save lives. So it is in everybody's interest. This is not a big bad government. It's not a big bad government at all, but it's not a big bad government. I should really stop giving these headlines free for all of the journalists. This is not about government saying to people, just don't do things or do things for the sake of it. This is in all of our interests. Every time any one of us, as I say, deliberately, because we're just throwing caution to the wind, or inadvertently breaches one of these rules, then we provide this horrible, deadly virus with a bridge to jump across. And if you give it one, then it'll find another and another, and before we know it, COVID is out of control again. So, think about it in that way. Don't be that person that allows it to spread. Don't be that person that allows it to transmit, perhaps a vulnerable person who ends up in hospital or dying. And if we all just remember that, think every time you go out, every time you leave your house to go wherever, just think about all of the things you need to do and avoid doing to keep this virus under control. And if all of us take that personal responsibility, we don't eradicate these risks, because that's not how a virus works, but we minimise the risk as much as possible. And I really do implore and appeal to people to think about it in those terms. Tom Eden from PA.
Thank you, Westminster. Good afternoon. According to research by NHS Lothian and Edinburgh University, outbreaks of coronavirus in care homes are up to 20 times more likely in large care homes. For context, with 20 or fewer residents, the chance of an outbreak was 5%. With 60 to 80, the likelihood rose to between 83 and 100%. Is this disparity something you and the government were aware of? And will this prompt any action or changes to your advice for care homes and their infection control?
We're looking very carefully at that research, and we're looking from at our own information, the information we've been publishing, to make sure that we are understanding, just as we are in how the virus is affecting different populations, how it's spreading in particular settings, and whether there are disparities, as this research suggests, between larger care homes and smaller care homes. And that will, of course, as necessary and appropriate, be reflected in the advice we give. But the advice to care homes right now, whether that's on isolation, infection control, testing, is very clear, and I know care homes are working hard to ensure that that is implemented. Do you want to say any more?
Only to say that this is an article published using previously published data. So we had seen this data. They didn't do anything new, and their best estimate of why is about footfall and number of people. It's not about quality of care in one or the other. So if you have relatives or loved ones in a small care home, you shouldn't be specifically worried because of this research. The guidance applies to all care homes, all settings, and is being managed by the Directors of Public Health, the care home owners, and everybody who cares deeply about your loved ones in those care homes.
Daniel Sanderson from The Telegraph.
Thank you, First Minister. You've mentioned a couple of times now that you're a bit concerned about the role alcohol can play in, people perhaps forgetting the rules or inadvertently breaking them. Early on in the pandemic, when the pubs first shut, there was some suggestion that when they did reopen, there could perhaps be a limit on the number of drinks one person could order. I think, 3 pints per person was mentioned. Can I just ask why you didn't move forward with that? And also, is it something that if problems do develop that you would consider bringing in at a later stage?
I don't recall personally suggesting that limit, but it's been a long 4 months, so I may have done, but I don't recall sort of saying that was something under active consideration. We set out guidance for hospitality, which talks about the need for seating, not having people gathering at bars, for example. Some advice around music, so that people are not shouting to be heard, and these are recommendations, and this is advice based on the best evidence of how we limit the risks of transmission. If we do think, and I'm not, so I am expressly saying here, this is not directed at the particular example you use. So this, what I'm about to say, would not justify a headline saying First Minister about to limit people to 3 pints of beer in a pub. But we will always look at whether there is evidence of different things that can help to reduce transmission, and if there are things that clearly tell us would help, then of course we will consider these. But that particular one is not one that we're looking at the moment.
And looking at me in case I had actually said it.
You may say that, Jason.
I promise I haven't said it. I absolutely specifically haven't said it. It does allow me to say something that I think is slightly confused, though. I was asked this on the radio yesterday, and then there was confusion, I think, in the reporter. If you are going with 3 pals to the pub, you still have to physically distance from the 3 pals if they're not in your household. The distancing applies to household to household. You don't get an exemption from the distancing just because you go with your friends. You're only exempt from the distancing if you live in the same household. Now, the 1 metre distancing exemption applies to everybody in that hospitality area, but with mitigation, signs up, and you are taking that risk because you see the 1 metre exemption as you go in. So it's important. You can't. I've seen, as I've driven around, groups around tables that worry me a little that don't always look as though they're in the same household.
Something else I should add, because if I don't say this, then I'm pretty sure the Chief Medical Officer is going to be giving me into trouble as soon as I get back upstairs after this. There are, of course, safe, responsible drinking guidelines that are in place not just during a pandemic, but at any time about the number of units that you should not exceed on a weekly or daily basis. And I would, of course, encourage people to stick with them at all times, not just now. Paul Mallock from the Courier.
Good afternoon, First Minister. The Scottish Dental Practice Owners Group have said in a statement released yesterday that they have no confidence in the consultation arrangement between the government and the existing representative body, the SDBC, who themselves have said that they find it difficult to negotiate with the Scottish Government. The Practice Owners Group said they have no confidence that the government will engage with the profession to develop a framework for NHS dentistry beyond the pandemic, or that the Scottish Government will be able to deliver accessible and high-quality dental care to the Scottish population. Would it be fair to say that dentists have maybe been overlooked during this pandemic?
No, it wouldn't be fair, and it's been very difficult for dentists. I don't want to underplay that, but I don't think that would be fair. In fact, I think it would border on being unfair to say that. But I will hand over to the dentist on the panel to maybe answer this in a bit more detail.
So the Chief Dental Officer has engaged with the British Dental Association's representative body. That's the right thing for him to do, and that's the representative body for dentists in general and has been for decades in the country. The Practice Owners Group is new. They have a particular set of challenges that we accept, and the Chief Dental Officer is keen to hear from them, engage with the broad profession to try and find a way through some of these really, really challenging elements. Dentistry is particularly difficult in this route map out because of the nature of what dentists do. They do have real good experience in infection and prevention control. We are confident in them, but there are over 1,000 practices that Tom Ferris, the Chief Dental Officer, has to have some kind of oversight and responsibility for. So he is working as fast as he can to get us to the next stage of that route map, bearing in mind what the First Minister said, that it has been difficult. There has been financial support for many dental practices across the country. That will continue, and we will get to the next stage of that route map as quick as we possibly can.
Thanks, Jason. David Ball from the Herald.
Thank you, First Minister. As the tourism industry reopens, Visit Scotland are encouraging Scots to travel close to home. Do you think that message potentially disadvantaged businesses in rural parts of the country? And what would you say to communities in isolated parts of Scotland who maybe fear an influx in visitors when the virus hasn't gone away?
Well, I think we're trying to balance all of these considerations and concerns. I've said here, and you've heard me say many times before, if you are able, not everybody is able financially or otherwise to take a holiday, but if you're able to take a few days away this year, think about doing it in Scotland, think about supporting our own tourist industry. And if you are going to a more remote part of our country, you know, whether that's the Highlands and Islands or any part of our country that is not as well served with health services and other infrastructure, respect that. And while it's important for everybody to follow the rules, be particularly vigilant when you're in a smaller or more remote community. I saw, and many people have seen this online, but if you haven't, I would recommend you have a look at a video that orkney.com posted over the weekend, saying how much they were looking forward to welcoming visitors back to Orkney, but asking people to do certain things to keep them safe while they were visiting the islands. So even if it's not Orkney you're going to, take a look at that video, because I think it really gives you a good insight into what we all need to do to get that balance right. Do you want to add, Fiona?
The Orkney message was, come and see the best of Orkney, but we want to see the best of you. And I think that was a good message and a good balance. We have a fantastic tourism industry. Its ambitions to be world class, but we need to support it as well. So make sure when you can, you visit and support places in Scotland, and our tourism industry needs you. So please support it, but be respectful of that as well. And if we do that, we can make sure we've got that sustainable tourism industry. And remember, tourism employs so many people. It reaches every part of Scotland, cities, towns, but yes, rural areas. But if we do that in a respectful way, we can make sure that we can support our industry, but also help suppress the virus. And I think that's the balance that we're at. And there's a lot of trust out there. We've got to where we are because people have placed trust in the message. They've trusted their neighbours and their friends. And then as we open up, they're going to have to trust other people, hotels, businesses as well. But if we do that with confidence, then we can make sure we can keep suppressing the virus, but also support our economy and our business.
One final point, which should be obvious, but just in case it's not, if you're on holiday somewhere and you experience symptoms of the virus, don't wait till you come home to contact the health service locally. Contact NHS 24, book a test and self-isolate where you are at that point. And that is important everywhere. But again, think about this. If you're in a small, remote, rural island community, that is really, really important. So remember that test and protect is in every part of the country and use it where you happen to be if you have these symptoms. Rachel Watson from the Daily Mail.
Thank you. This is for the First Minister and for Professor Leitch. You both said that you're nervous about the reopening, the move further into phase 3 this week. Are you personally nervous about this, or will you both go out and kind of embrace these changes, go to a pub perhaps, the hairdresser, or are you nervous about attending busier places like this?
I'm both personally nervous as a citizen, and I want people to go and enjoy these freedoms, but how can I put this properly? A wee bit of personal nervousness right now is not a bad thing, because it might just make us that bit more cautious and that bit more likely to follow these rules. So actually, think about things a bit more. So yeah, I have that personal nervousness, but obviously as First Minister, I'm very nervous about the impact on the country overall, which is why I want people collectively to think about this really carefully. But I do want people to support local businesses, and we need to get our economy onto a path of recovery here as well. I visited a pub a couple of weeks ago before the opening of Outdoor. I will happily visit pubs and comply with all the rules, and I can exclusively reveal that I do hope to visit a hairdresser very soon, hopefully very soon indeed. Jason, are you going to the hairdressers anytime soon?
I am. I'm going today.
There we go.
So, no, tomorrow, Thursday.
You should maybe check the time of
I need to
appointment.
check my appointment. But the answer to your question is actually held in the advice I give to my family, I think. So I am nervous on a personal level, and I am, of course, nervous for the population. If I was uncomfortable with what we had done, I think you would know that by now. So I'm not uncomfortable with the route map. I'm just anxious about the route map. So when my dad asked me if he could go for a haircut this morning, I said, yes, you can, but you need to make sure this is in place, and I shouldn't advertise barbers live on the television. But he went to Peters and Airdrie, and he just sent me a text before I came down and said it was perfect. He was held outside for a little while. It was perfectly safe. Peter himself cut his hair, and he's absolutely delighted. But I am cautious about sending my parents to crowded places. So I'm asking them if they go somewhere crowded, but that's been true of the supermarkets up until this point, to go somewhere else.
Apologies to Peter and Airdrie for the press attention that we have just conferred upon you. Hopefully you will find that positive. But that's the thing, follow facts. That's my advice. The nervousness we're talking about here today would be there if we were opening today, next week, a month from now. It's always going to be a nervous thing to do when we take this biggest step yet. But if we all follow this advice, then hopefully these nerves prove to be ill-founded. Gina Davidson from the Scotsman.
Thank you, First Minister. This is probably a question for the Cabinet Secretary for the Economy, and I apologise if you mentioned this in your remarks because my broadband was playing up a bit, but I was wondering what was happening with the money that was left over from the business support grants after the deadline for applications closed last Friday, and what was happening to the $17,000 applications that had not been processed at that time. Thank you.
Okay, well, can I be clear that the number of not processed cases includes those that have been understandably rejected under the criteria, so it would be incorrect to say that they're not processed. Indeed, in terms of the amount and volume of businesses that have been supported, we know over 100,000 businesses have been supported by that small grants scheme. You're correct in saying that a number of those closed. We're reconciling the figures and to see and identify if there is additional funding that can be allocated to businesses. We were quite clear everything had to go to businesses. We've ensured, for example, those that have been supported in the tourism sector would have an opportunity, and Fergus Ewing will set this out, for additional support, and that's what we're hoping to do. I've already announced support for our theatre venues, and you heard that, how important that is to lots of places across Scotland. But we're also identifying if there is any additional underspend, and we won't know that until the full reconciliation, how that can be spent. But be under no illusions, our schemes have been quite distinct and different and unique. We had a creative tourism and hospitality hardship fund that didn't exist anywhere else in the UK. We've also supported companies and businesses right across the country with our resilience fund, and some of those were receiving amounts of £150,000, in some cases £250,000, that would never have been available elsewhere, but these were pivotal and they were absolutely unique. And in terms of our support, we recognised if they weren't supported, then they would be losing jobs, and we've kept that resilience. But we'll make sure that there's openness and clarity about what we're doing. We've said that from the start, and we'll make sure that every penny goes to businesses.
Tom Martin from the Express.
Hi, thank you, First Minister. Just going back to the economy, I don't know if you caught it this morning or have been made aware of it, but Jim McCall was quite critical this morning of a lack of business experience in government, and also lack of support for SMEs, and warning that up to half of Scotland's SMEs could disappear during the fallout from the pandemic. I just wondered what your thoughts on that would be.
I've not seen the comments, but in general terms, government has a range of expertise. We work very closely with business. We're looking to deepen our business engagement, and SMEs, like businesses of all shapes and sizes, face a really difficult path ahead, which is why the work we've talked about already is so important, and we'll keep focused on that. What I said earlier on remains the case. Over these next months, health and jobs will be the twin focus of this government as we navigate that path to recovery. Kieran Andrews from The Times.
Thanks very much, First Minister. On that note, both yourself and the Economy Secretary have praised the VAT cut. I wonder if you have given, what consideration you've given to extending the business rates holiday for the hospitality sector, perhaps indefinitely, and perhaps introducing cuts in business rates to other sectors such as high street retailers, manufacturers.
We'll consider all of these things as we take our own decisions, and we'll do everything we can reasonably within the financial confines that we operate within to do that. One of the reasons, of course, we've been arguing with the UK government that we should have greater fiscal flexibility is to allow us to do more, and therefore that case is one we continue to make very strongly.
And indeed, in terms of support, that rates relief that we have already provided for the tourism and hospitality sector is really welcomed. We continue to work with them. There is a tourism task force led by Fergus Ewing with the business community from tourism themselves, working out what support they might need going forward. But clearly we have to understand that we're in pressured areas, and we know, working with our finance secretary, we're going to have to manage a very challenging time ahead of us. But when we have been able to move and flex, and we've made changes to the business grants arrangements already, and we know that the pivotal and hardship funds that I talked about really targeted tourism sector businesses in particular, we know that we've done far more, I think, than in other parts of the UK to support that sector. But of course, it's more important to us as a country in terms of our underpinning of our economy, and that's why we do need to give them that support. And today is a very important day for our tourism sector, and we wish the businesses well. We want their customers to go with confidence. We want everyone to be vigilant, and then that way we can get a sustained economic recovery, and it's a sustained economic recovery that our tourism sector really needs.
And lastly today, Chris Musson from The Sun.
My First Minister, just picking up on what you said earlier about the relentless health and jobs focus and how we're going to keep the population healthy is what you said, I think. Now, obesity is a known COVID risk factor. So given what you've said, why have you shelved your junk food promotion law until after the 2021 election? And this is, of course, just when we're told that Boris Johnson is gearing up for similar restrictions in England. That's not a good look, surely.
I think you actually know the answer to that question, Chris. It's about parliamentary time. It's about having to prioritise, given the loss of time for COVID, what we need to get through Parliament before the election. It does not signal in any way, shape or form a diminution or abandonment of our commitment to tackling COVID. But sometimes these practical constraints just can't be got over. And as I say, I think you probably had that explanation at the time, but we will continue to take very seriously the challenge against obesity, because it is, and you're absolutely right to make the connection between some of what we know about COVID and the importance of tackling obesity. So it remains a really important priority for us. That concludes the questions today. My thanks to the journalists, to Fiona and Jason and Yvonne, the BSL interpreter for today, and thank you to all of you, as usual, for joining us. Let me end on a positive note. This is a good day today. We've just, for the 7th day in a row, reported no deaths of people who'd been confirmed with the virus through a test. We've reported some really positive news on hospital admissions. It's going in the right direction, and there are many businesses across the country that are opening the doors again today for the first time, and many of us as citizens will be able to do things for the first time today or in the days that follow today that we've not been able to do for months. So it's a good day. It's a day that we should feel positive about. But it should also be a motivational day for us. It should be the day we collectively resolve not to go backwards, that we're going to continue with this progress so that we can continue to see the good news that we've been reporting today. So that means, and this will be my final word as usual today, it means remembering the facts. Face coverings in enclosed spaces, avoid crowded places, leave a place indoor or outdoors if it's crowded, clean your hands, clean hard surfaces, 2 metres distancing, and self-isolate and book a test if you have symptoms. If we all follow that advice, then we can have many more good and positive days to come. So my thanks to all of you for that, and I will see you again here tomorrow at the same time of 12:30.